Hi, everyone. Thank you for joining us today. I'm Audra with Harmony Hospice, and we have Lily Mees here, and she is doing our CEU today on diabetes self-management. And then I'll have Lily kind of tell you about herself and how she started stepping forward.
Yeah, hi everybody. My name is Lily Mace. I am the owner and founder of a company called Stepping Forward, which started several years ago regarding teaching on prevention and maintenance for chronic disease. So we help caregivers, we help care owners to better manage their members, their clients, their residents on chronic diseases. And one of the diseases in particular is diabetes, which is our signature program. And we are offering the CEU today, and we have several other CEUs that we can talk about later. My husband is of course, the marketing guru that helps me along the way. So today we're really going to go over the diabetes 7 self-care behaviors. This is near and dear to my heart. I'm very passionate about this. It's going to be a lot of information, but it's an overview. I was telling Audra that we can really dive into a lot of these topics all by itself. So if you're interested in that, you'll have an opportunity at the end regarding how to get a hold of us and how we can do this and provide more value to you and your residents. All right, let's get started. So what we're going to talk about today is, as I mentioned, we're going to talk a little bit about what is diabetes, some statistics and causes of diabetes, and then the AADE is the 7 self-care behaviors, which just include healthy eating, problem solving, being active, healthy coping, monitoring, reducing risk, and taking medications. And as you see, that's a whole lot of information, but we'll do the best we can in the hour that we have. And I definitely want to let some time for questions. So if you have questions during the time, you want to chat it in there, type it in the chat. I'll just keeping a good eye on that, and then we'll go over a short little assessment at the end, just to make sure you got some of the nuggets out of this presentation. So, all right, so what's the big deal about diabetes? Well, it is a big deal because the numbers are growing. There's 37.3 million people, and it keeps going up. It's very costly. It costs the society and medical systems, also personal costs. And it obviously is a serious long-term health problem because there is no cure, but we can certainly manage it. And one of the focuses that I really hope to encourage you to take away from as well is to look at also pre-diabetes and helping kind of ward off getting type 2 diabetes through some weight loss and exercise and nutrition. There's a great program called the Diabetes Prevention Program that is a free, available program for anybody that has pre-diabetes. I can tell you more about that another time. So here are just some stats, and I took this updated it yesterday from the CDC. And as I mentioned, there's 37.3 million people that have diabetes. That's about, 11%, 10% of the US population. There's about 28.7 million people that are diagnosed. And this is kind of staggering, but most of those people, about 23%, they are undiagnosed. And they actually say it takes about sometimes 7 years before somebody finds out they actually have diabetes. And so we want to really help people with finding out for sure if they are someone that has prediabetes and what they can do about that. As you see, the numbers on the bottom is 96 million people over the age of 18 have prediabetes. That's almost like 40% of the population. So that is right now people who have prediabetes, and there's a lot that can be done for that. And actually Medicare covers a program called the Diabetes Prevention Program that's free, that's available. You can do it virtually. That can help people if you lose 5 to 7% of your body weight through exercise, nutrition, healthy lifestyle. You can decrease your chances of getting diabetes by almost 60%. which is incredible. 65 years or older, there's about 26.4 million people, which is about 50% who have prediabetes. So it's a big deal. It's not going to go away, and the numbers are actually increasing. But there's a lot that we can do about it, and that's what this talk is about today. So what is diabetes? The American Diabetes Association says that it is a disease where your blood sugar is too high because you can't make or use insulin. So we certainly will start with the lifestyle as a foundation to prevent diabetes and to also maintain diabetes. But there are other things that we have to add in there as well to get those numbers within target so that you don't have complications. We'll talk about that in a minute. So the top one is diabetes is a group of metabolic diseases characterized by high blood glucose levels, results from defects in the body's ability to produce or use insulin. So you have insulin, but you're not using it correctly, or the body's not able to use it correctly, I should say. And then type 1s don't have insulin at all, so they need to use insulin for outside the body. All right, so we're going to talk a little bit about just a very quick, brief overview about what happens. So basically, you eat carbohydrates, and all carbohydrates turn into glucose. Glucose is a fancy word for sugar. We need that for energy. So after eating, your body breaks down the carbohydrates into glucose, and insulin is basically like a key that carries the glucose to the cells, where it opens the door to the cells and allows glucose to enter in. And the reason we need that is obviously for energy. So glucose, carbohydrates are used primarily for energy. And without having enough insulin opening up those doors to the cells, glucose is just stored in your blood, and it causes hyperglycemia, which is high blood sugar. And that mechanism is faulty, but it can certainly be fixed. So inside the cells, glucose is burned to produce energy. There are several symptoms that, sorry about that. There are several symptoms that cause that the reasons what cause type 2 diabetes and type 1, as well as gestational. But some of these are like, if people are feeling tired, they have excessive thirst, they have blurry vision, excessive hunger, weight loss, frequent urination, slow healing, tingling and sensation, which is neuropathy, damage to the nerves. So these all can potentially be signs and symptoms of having type 2 diabetes or even prediabetes. So I always tell people that when in doubt, check it out. If you're not sure what is going on with your body and you want to find out, you can always ask your primary care provider to run some labs to see if you have diabetes. We'll talk about that a bit more. So there are different types of diabetes. So there's type 1, type 2, gestational, and pre. There are other types of diabetes that are kind of outliers, but we'll just focus on the main ones here. So type 1 is an autoimmune condition. It is basically where your body, the insulin that's in the pancreas, your body gets a virus, and it destroys the insulin that is produced in the pancreas. So, it basically attacks the good cells, which are insulin. People know this as type 1 being juvenile diabetes, but actually this can happen later in life in adults. There's only 5 to 10% of people that have type 1. It is an autoimmune disease. You absolutely have to have insulin to survive. Otherwise, you're going to be malnourished and you're not going to be around. Type 2 is more of what the population is. So that's about 90-95% of people, usually diagnosed in adults, and it's basically insulin resistant. So as I mentioned before, your body's producing insulin, but maybe not enough. There's also things that are going on with your liver. There's things that are going on with different organs. So it's a bit more complicated with type 2. That's why we have a lot more medicines for type 2, because it works on different kinds of parts of your body to help you become less insulin resistant and more insulin sensitive. Gestational is insulin resistance caused by pregnancy hormones, and 3 to 5% of all pregnancies have gestational diabetes. It does tend to go away afterwards, although women are still continuing to be tested for diabetes. And they say that maybe 50% might get type 2 diabetes if they have gestational diabetes. Prediabetes is the beginning of insulin resistance. Like I said, that's the highest amount of people that have prediabetes. Its glucose levels higher than normal. And there's a lot that we can look at doing for that. So just a couple little bits and pieces of information. So it's interesting, during the COVID-19 pandemic, diabetes emerged as the underlying condition that increases the chance of severe illness. So the numbers were, almost half of 4 out of 10 adults who died from COVID-19 in the United States, they also had diabetes. So diabetes is a vascular disease. It affects people from head to toe, and it can ruin the integrity of your arteries, of your organs, of all kinds of things if we just kind of ignore it and let it run its course. But there are a lot of things that we can do to either prevent or maintain our diabetes, and that's really the focus. Adults with diabetes, they have a higher risk for heart disease, 2 to 4 times greater, and it's the leading cause of new cases of blindness. Medical expenses are 2.3 times higher for people with diabetes. They got to buy strips, they got to buy, medications are expensive, the doctor's appointments, etc. So it is a costly chronic disease. So why is diabetes increasing? Lots of reasons, but these are probably the main ones. Increasing in obesity, more people are sedentary, more people are aging, 65 years old every day. There's a greater amount of aging population. There's increases in high risk groups, different cultures, and changes in diagnostic criteria. So maybe tighter targets and tighter diagnostic criteria in terms of saying that somebody either has prediabetes or diabetes. So we are going to talk about the 7 self-care behaviors. So like I said, we're just going to briefly overview. We're going to talk about healthy eating, being active, monitoring, taking medications, problem solving, healthy coping, and reducing your risk. And one of the questions is, can you tell me, and I'm giving you a little bit of a heads up, can you tell me 3 or 4 different self-care behaviors that we talked about? So try to remember these as we go, at least some of them. All right, so healthy eating. So, I think this is probably one of the number one things that we can control, that we can get help with. And as I mentioned, all carbohydrates turn into glucose. Glucose is not bad. Glucose is necessary for us to have energy to be able to function. Now, too much glucose, too much carbohydrates is what the problem is. And what kind of carbohydrates? So the first thing I always tell people is, do you even know what a carbohydrate is? So there are 4 different types of carbohydrates. There are starches, so that includes breads, rice, pasta, cereal, corn, beans, starchy vegetables. There's fruits, that is a carbohydrate. The third one is milk, yogurt, and ice cream. Those have protein in it, but they also have carbohydrates, a little bit of both. And then, of course, everything that everybody loves is all the sweets, the donuts, candies, cakes, etc. And a lot of people think, well, I can never have a donut. I can never have, these things because they cause my sugars to go up because it's a carbohydrate. But you do need these because this is the primary fuel that feeds your body. You need proteins, you need fats as well, but carbohydrates is the main fuel source that the body uses. So knowing what is a carbohydrate, what kind of carbohydrate, how much carbohydrates, is really the key. And that's where I think a one-on-one dietary consult for anybody that has diabetes, prediabetes, is really going to help them to better manage their nutrition, their diet, their meal plan. So simple, just a simple way to look at it is how to make a healthy plate. So there's a actual website called choosemyplate.gov. And what the premise is that you divide your plate into and first of all, it's about a 9-inch plate, so it's not these big plates. So it's a smaller plate, and you divide it into half and then quarters. And so half of your plate should really be fruits and vegetables. So, and they're considered non-starchy vegetables, some fruit. The other half should be grains, and then some kind of protein like seafood, like chicken, like pork. And that's, you have some dairy on the side, but that gives you a good idea of like, what is the balanced plate looks like. Some people also count carbs, especially when they're using insulin. So one serving of carbohydrate is equivalent to 15 grams of carbohydrates. And usually it's up to 3 to 4 servings per meal. So kind of quick and dirty, but if you do the choosemyplate.gov, it's kind of a simpler way to kind of look at what you're eating, and then getting that dietary consult for more in-depth individual nutrition plan. So physical activity is, as we all know, it's good. It's healthy. There's so many benefits of it. Lose weight, lower risk of heart disease, probably maybe reducing your medication needs. You get more energy because you're putting more energy in. You feel better. Your neurotransmitters and your depression and mental health is your mental health is a lot better. Depression is less. So one of the things about physical activity is it because you do some kind of exercise, or even just work around your house and cleaning and just moving, period, it causes the body to have to get energy. And where does it get energy from? Well, it gets energy from the glucose that you just ate. So it causes your blood sugars to go down, and not necessarily up. So exercise is really, really good to help manage your blood sugars and get it into the target zone. So I always tell people, after you eat, try to go for a walk. After you eat, try to do some kind of physical activity, because it's going to use all that good food that you just ate and help to bring down those blood glucose within range. Most people, they eat and they don't really want to do something. They just want to sit on the couch, do the remote, and nowadays you got to get a little creative because it is kind of hot out there, but try to do some kind of activity, whether it's indoors or early outside, early in the day or later in the day, because that is going to help your blood sugars for sure. All right, thought this was kind of funny. So a guy goes to the doctor and he says, what fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? The guy just is like looking at him like he's crazy. So even if you can do a little bit of exercise, I tell people just, the recommendation of the American Heart and the ADA is to try to do 30 minutes of exercise 5 times a week. That's 150 minutes a week. That sounds like a lot, but if you break it down and just begin with maybe 10 minutes of activity, doing swimming, doing biking, doing walking, something that, kind of helps elevate the heart rate and is just moving. And if you want to break it up into, 2 times a day at 15 minutes, that you could do it that way. Or you could just build up to 30 minutes a day times 5 days a week. Slowly increasing your time. I always recommend strength and conditioning and training 3 times a week, 2 to 3 times a week. That's using, TheraBand or TheraTubing or any kind of, Bowflex, strength and conditioning kind of exercises. That actually helps to build up your metabolism. It strengthens your bones. It helps you with balance. It does a lot of great things. So if you can start doing that and marking down when you do it, you'll be able to create a habit, and you'll be able to see the benefits of it. So I always tell people, keep it fun, do something that you enjoy. People get bored, people don't have time, people get, there's all kinds of reasons, but try to do something that you enjoy. As a person gardening, doing it with somebody, that having more accountability, doing something that, as mentioned, that you enjoy. So kind of mix it up and keep it fun. All right. So one of the things to be careful about is when somebody is exercising, especially if they're on insulin or medications that cause the blood sugars to go low. They should really be careful for hypoglycemia. And hypoglycemia is when your blood sugars are less than 70. And exercise, like I said, reduces your blood glucose, so it causes the blood sugars to go down. So the goal is to make sure that if you're on those kind of medications, to check your blood sugars before you go with the glucometer. We'll talk about it in a minute. And then take a lead. If it's 70 or 80, you know, with exercise, it's going to go down more. And like I said, only if you're on medications that's going to lower the blood sugars already, then I would have like a 15-gram snack. Take a snack with you, and it could be, you know, carrying, it's a fast-acting carbohydrate. So something like, you know, 6 to 7 Lifesavers, a little thing of juice, like the kids use at 15 grams of applesauce, or something that you can take with you. Some people carry glucose tablets. So those are right about 4 glucose tablets is about 15 grams. So the thing is to make sure that you get the blood sugars up before the blood sugars go down. Otherwise, if it keeps going down, it can cause, it can be life-threatening, and it can cause people to pass out. And, you know, you want to be proactive rather than reactive. So talk a little bit about glucose monitoring. So the reason that people glucose monitor is to see what the blood sugars are. And when you eat, the blood sugars go up, and then they kind of either stay elevated, hopefully they come back down, which is what they should do. And then you eat again and it goes up. So eating, you know, the blood sugars to go up right after eating is a normal process, but for it to stay up and to continue to be up for longer than, in 3 to 4 hours, if your blood sugars are still 180, you know, you certainly should be concerned about that. Because that's considered hyperglycemia. So that's why walking after eating is helpful to get the blood sugars within target range. So what is the target range? The target range is, we'll get back to that slide, is from the ADA, is fasting, which is before meals. It should be between 80 and 130. For some folks, it's going to be 90 to 150, but mostly it's 80 to 130 for people who are able to keep it in that target zone. 2 hours after a meal, it should be less than 180. When you eat again, usually about 3 to 4 hours, it should go back to before the meals, 80 to 130. So, you know, your blood sugars does vary all day and night. And, but we want to try to, you know, we're not looking for perfection. We're looking for progress. We're looking for just ways that we can get these blood sugars within a better target and within a better range. And why do we care about that? Because if you don't, it will cause a lot of complications. As I mentioned earlier, this is a vascular disease. It affects you from head to toe. It affects all kinds of organs, your feet, your heart, your kidneys, etc. So we do want to make sure that we are looking for the right target zones and going towards that, if not being right on point. So let me go back. The glucometer is it's basically a machine that most people know already, but you know, you buy it, you can buy it over the counter, usually by prescription. By prescription, it might be covered under your insurance, and it's prescribed by a provider along with any medications. So you want to wash your hands, get a drop of blood, place the blood on the test strip, and record the reading. And the reading should be here. Now, one of the things that the doctor will order at times is a blood glucose average, a 2 to 3 month average of blood sugars. And it's called an A1C. And an A1C just tells me what the blood sugars have been in the past 2 and 3 months. So what we're looking at is a certain percentage. So we're looking at less than 7% for most people, and less than 8% for elderly. So the higher the number, the more the blood sugars are out of range. The more tighter the numbers, the more within the target range, then you'll see the A1C reflect that, being 7% or less than 8%. So why do we care about the blood glucose monitor? As I mentioned, because it's basically like a compass. It tells us where we are, where we need to be. And there's all kinds of different fancy kinds. There's also, we can do a whole talk on technology, but there's also what they call a continuous glucose monitor that people wear on their arm or on their belly. It is prescribed by a provider, and it tells you what your blood sugar is every 5 minutes. It's tested in the interstitial tissue, so not actually in the blood, and it's pretty close to what the glucometer is. And why that is beneficial, so people can see, you know, when we eat something, what my blood sugars do, and they can have a better idea of, you know, what's happening with their blood sugars and how we can better manage it. Also, there's insulin pumps, there's insulin pens, a lot of good drugs now that really can help people, as well as technology. All right, so we mentioned a little bit about hypoglycemia. So that's when your blood sugars are less than 70. So if you ever get residents that, you know, they're weak, they're sweaty, they're shaky, they're hungry, they're irritable. It could be a lot of things, right? But these are all signs and symptoms potentially of hypoglycemia. And you think of hypo being kind of like a hypodermic needle. It's very small, so low numbers. So the blood sugar is less than 70. And the rule of thumb is when in doubt, check it out, and you have to treat it. Otherwise, people can pass out. And like I said, it could be life-threatening. This is one of the most things that you want to help prevent. Usually this happens is because, you know, people had too much medications, they skipped their meals, maybe they exercised a lot. Those are kind of some of the reasons why people get hypoglycemia. So how to treat it. So you want to eat or drink a carbohydrate food. So something simple, a simple carbohydrate, not a whole sandwich and, you know, something like pasta. You don't want it to be complex. You want it to be simple. So you see the glucose tablets, the raisins, the little Minute Maid orange juice, 4 ounces of juice, 4 ounces of soda. And then you want to repeat it in 15 minutes with the glucometer. And the numbers should go up. So if it's 70, it should start going up to the 80 range. And if it doesn't, you want to repeat this again. Hopefully that'll take care of it. And then eat a meal within the next hour. So a meal or a snack with proteins and carbohydrates. And the reason I say proteins is proteins kind of help stabilize the blood sugars a bit better rather than just having a carbohydrate. If it's still, you know, not, you know, after you've done it a second time and the blood sugars are still low, you really want to call 911 and get help for that person, because it's going to require more than what you can provide for them. All right. Then there's, so on this one end is the hypoglycemia, and then we swing to the other end as hyper. Think about a hyperactive child, you know, somebody that has a lot of energy, too much sugar. So the blood sugars are greater than 180. And the reason why that happens, and you're never going to, it's not about getting perfect numbers. You're never going to get perfect numbers, but you want to get within the target. And if it's a pattern that, you know, I'm having 180, 200, 300, 400 every single day after I eat such and such, you got to look at what is the cause and get treated for it. You can't just leave it undone, especially if it's a pattern. So you want to look for reasons: unhealthy food choices. Maybe you forgot to take your medicine. Maybe you have stress or illness. So you want to definitely work with your team on finding out, you know, are you on the right medication management? Do you have is your dietary intake correct? You know, so the monitoring is really important because it tells you where you are, like I said, like a compass, and what you need to do. So those are just the hypo and hyper. Those are the two main, you know, discussions of blood sugars that are at a range, and that's important to know. So diabetes medications, this is a whole talk in itself, but type 1s, insulin is always needed. Basically, you don't have, your pancreas is not working, you're not producing any insulin. So if you don't have insulin, the key that allows the glucose to go into the cells, all that glucose is in your body, is in your bloodstream, and you begin to pee it out and you begin to get malnourished, so you're not getting nutrition. So people with type 1 diabetes, before insulin was founded in 1933, they would actually die. They would not live for many years. So insulin is always needed, whether it's shots, whether it's by the pump, and that's the type 1. Type 2, lots of good medications. A lot of times they'll be able to start on one oral med, then maybe 2 or 3. There's lots of great medicines that are heart protective, that are kidney protective, not just for your blood sugars, but for the rest of your organs. And, you know, there's a whole talk on that, but it may be a combination of both. And, you know, maybe they've tried 3 medications, oral medications, and it's still, the blood sugars are still high, the A1C's still elevated. Then they might need to be on insulin. And insulin is not bad. Insulin saves lives. So and it's nothing, you know, people think, well, I'm not doing the right things or I'm failing. It's not that you're failing, it's that your body is failing. Your body's not producing and working the way it should. So it needs more help. So it's good to evaluate the medications. It's good to evaluate, you know, what you took maybe 10 years ago is not going to be working now, because diabetes is a chronic disease. So get whatever it takes. Here's what I say: whatever it takes to get the blood sugars within range, that's what you want to do. And certainly lifestyle and is the foundation for it, changes, but it's sometimes it's not enough. So talk about tips for medications, just making sure that you use some kind of pill counter or pill box. You should know about these medications for your residents. Doesn't mean you have to be a pharmacist, but you should understand what some of these medications do. And then for those that are out there and they're just, you know, a list of medications and dosages, it's always good to have, and bring it to your healthcare providers. All right, so problem solving. Problem solving is another one that, you know, how do I deal with issues when I don't have my insulin, when I don't have, you know, a glucometer is not working, or when I can't afford this medicine. There's a lot of different, when my sugars are 300 and they're not coming down. There's a lot of issues with, you know, problem solving. And one of the things I say is utilize your diabetes care team, utilize your providers, your nurse practitioners, your pharmacists, nurse, dietitian, diabetic educators, and really you're only good as your team. So you want to get your team involved and not try to just, you know, figure it out all by yourself, because, you know, diabetes is a serious disease, and there are so many people that specialize in different areas that can help you better manage your residents, yourself, your family member, etc. So don't hesitate to call. Like I tell my patients, you know, if their blood sugars are 300 every day for like the past 3 days, you need to call your provider and talk to him about maybe increasing your basal insulin, or, you know, meeting with a diabetic educator, etc. All right, sick days are another thing. Like, people don't know what to do. Should they keep taking the medicine? Should they not? Usually they say still take your medicines, try to eat something. If you're vomiting, nausea, diarrhea, you definitely want to call your healthcare team. It says a sick day menu, so those are probably things that, you know, maybe lighter kind of foods, but not eating, not taking your medicine, not calling anybody. That's not the way to handle a sick day. So just try to prepare for it, have your numbers, and you know, you should always call, you should always ask. There's never a dumb question. I hound my providers all the time, so that's what they're there for. All right, so when we talk about healthy coping, a lot of people with diabetes, it does affect the whole person. It does affect them, physical, emotional, and mental health. And they are high risk for depression, for discouragement. You know, anybody that has a chronic disease, it's a day in, a day out kind of thing. It does affect people because it affects your quality of life. And you're not able to sometimes do some of the things that you want to do because you're not feeling that great. So depression is a real thing. There's actually a thing called diabetes distress. when somebody gets tired of taking their blood sugars and tired of taking the medicine, diabetes, burnout, and then depression, of course. And there's also issues with anxiety. I've met people that have a lot of anxiety because of hypoglycemia. They're worried about, the blood sugar's going to get too low at night, and are they going to die, and what's going to happen, to the family. And so anxiety is a very real emotion as well, and they need to be addressed. So depression, as I mentioned, if you notice that one of your residents or someone even in your family, they're not doing anything for like, 2 weeks, a week even, they're not going out, they're not doing things, their sleep has changed, their appetites change, they don't enjoy the things they used to, they're feeling sad, they're hopeless. Maybe they've even talked about ending their life because, being on dialysis really sucks. And I hate losing my leg. And what am I going to do? So there's a lot of things that certainly the chronic illness is affecting their mental health. And I always tell people that there is no health without mental health. I'm a big proponent for that. When your mental health is not good, you're not going to want to take your medicine. You're not going to want to eat. You're not going to want to check your blood sugars, exercise, all those things that are healthy for you. So you got to address, sometimes it's the elephant in the room, but you got to address their mental health. And sometimes, seeing a counselor, psychiatrist, being on an antidepressant drug, there's no shame for that. People sometimes have so much stigmatism with, I don't want to be on an antidepressant drug, it's another medicine. But if your doctor told you to put you on a medicine that for for hyperglycemia or for hypertension or for an antibiotic, I mean, you probably wouldn't argue with them too much. But because it's kind of like, most people don't talk about it, and sometimes it has a negative connotation. But antidepressant is sometimes needed for the physiological brain and just for you to get over some it might be situational depression, to get over some of this depression. Talking to somebody, I'm a big proponent for that as well. I tell people, when you need counseling, when you don't need it. I mean, we take care of our cars, our things, our stuff better than our mental health. There's something wrong with that. So get the help that you need. There's nothing wrong with that. And there's certainly effective treatments for it. And you're going to be better overall with your overall health and your quality of life. So I always tell people, stress and it causes hyperglycemia, causes the blood sugars to go up. You can't live in a bubble. We live in this life, but make time for fun. Learn how to manage stress in a healthy way instead of, maybe going to more food or more drinking or, just, I don't know, doing something that maybe is not as healthy. Try to look at things that you can do that are healthy. So hobbies, leisure, taking a bubble bath. I love that. Relaxation, meditation, talking to someone. Don't beat yourself over the head because your blood sugars are not in range. We're not looking for perfection. We're just looking for progress. So reducing your risk is another of the 7 self-care behaviors. And as I mentioned, is diabetes affects you from head to toe, and it causes it can cause complications. And so we want to prevent those complications. And the studies show that people who have their A1C less than 7% reduce the risk of complications, microvascular complications, which are dealing with the smaller vessels. But this is, we're talking about right here is macrovascular. So those, when we talk about macrovascular complications, those are the large blood vessel damage. And people who have diabetes are high risk for stroke. We mentioned the heart attack, poor circulation. So you see people that lose their limbs, they lose their foot, they lose their toes. It's usually due to long-term, as mentioned, complications. So it doesn't happen overnight, but with the blood sugars just not being managed and not being within target and just being left, out of range, this is what causes issues. So it causes the plaque inside of the arteries. It also ruins the integrity of the artery. The arteries are supposed to be like a rubber band to push the blood through to deliver the oxygen. And the arteries become stiffened. They can't do the job, so then more work is put on the heart. And, you know, fatty deposits. You can't get the blood to deliver the oxygen to the cells, whether it's in your brain, whether it's in your heart, whether it's into your lower extremities, and that causes problems. The microvascular disease, there's a small blood vessels and nerves, and this is what uncontrolled diabetes can cause nerve problems. And you guys probably seen it, you know, people have problems with their feet, their hands, the hearts, the circulation with their stomach, the bladder, their sex organs. Neuropathy is not just in your, you know, feet and hands. It's certainly in all of those that I mentioned. There's also, you know, we talked about diabetes being the leading cause of blindness and kidney disease. So it ruins the integrities, it ruins the blood vessels. All of that sticky glucose is, when it's elevated, or even when it's low, you know, uncontrolled and has so much variation, it ruins the nerves and it ruins the microvascular complications. So that's why we should care about getting these numbers in target, care about those that we're taking care of, and you know, not have diabetes as kind of like an afterthought. Oh, they have all these other things wrong with them, but diabetes is usually the cause of their hospitalization. You know, they don't mention, they don't say, well, a person has diabetes. They say, person has renal failure, person needs an amputation. This is why they have to go to the hospital. And in the root of it is the diabetes is not well managed. Learning how to keep your feet healthy. So just, I threw in the slide because amputations are certainly high risk. So people, you know, making sure that they look at their feet, they're not walking around the house with no shoes on. I actually had a member say that he went outside when it was like 100 and something degrees. He had no shoes on, he had neuropathy. He was there for like maybe 10 seconds, he said. And he didn't realize that his foot burned, his feet burned. He had a blister, turned into infection. He lost his metatarsal. So definitely making sure that you look at the feet, that you make sure that your doctor looks at your feet. Go to a podiatrist if you need to, because this stuff can be avoided. This stuff can be prevented. Check the feet, use a mirror, look at changes in color, blisters, calluses, dry skin, cuts and sores. So important to inspect the feet and wear shoes, proper shoes. All right, so we are getting to the end of it. So we want to really encourage people to adopt a healthy lifestyle, keep the blood glucose in target range, making healthy food choices, physical activity, get tested for regular A1C. The blood pressure is important, cholesterol, triglycerides, and if you smoke, definitely get help quitting because it ruins. It's a vascular disease, and then you're smoking on top of it. It's causing a lot more damage. All right. So here's just some of the tests that you should get every 6 months. If it's not well controlled, sometimes it's every 3 months. A1C, blood pressure should be checked at every visit. Definitely want to make sure the dental checkups, because people tend to get periodontal disease, a lot of bleeding, and you know, you could lose your teeth. It can cause a lot of problems as well. Every year, blood lipid, unless he wants or she wants it sooner. Eye exam, foot exam, checking your urine for kidney function. Get your flu shots, get your vaccines. So it's quite a bit of work to manage diabetes, but I think once you're in a rhythm of doing it, these become, you just make it a priority. All right, are you guys ready for questions? Okay, so name 3 of the, name 3 of the diabetes 7 self-care behaviors. Just type it in there.
Can type that, yeah, right here in the chat box.
Yep, I'm just going to shout them out. There's 7. I almost said maybe 7, but I thought, well, maybe 3 would be better than. So
Can I type one in?
yeah. So think about what we
Diet.
talked about.
Okay, exercise. Someone just type that in.
Yep, that's 1.
And healthy foods, exercise, follow up with doctor, exercise, leisure time, diet, healthy eating.
So we got, I've heard 2 so far, exercise and nutrition.
Yep. Problem solving, being active, healthy eating.
Problem solving's 3.
Follow up with doctor.
Follow up with doctors, that we just added that in as a definite.
Reduce stress.
Reducing stress. Yeah. Let me go back. Go back to this first one. Here we go. So we talked about monitoring, right? What are the target? What are the blood sugar numbers, right? We talked a lot about that, hypo and hyper and all that. Taking medication. Problem solving, you guys said that one. Healthy coping, somebody said manage stress, so I would put that in that category. And reducing your risk. So reducing your risk for micro and macrovascular disease is by getting the A1C in within target, blood pressure, cholesterol controls. So these are the areas where really, this is what they found is what people really need to focus on. All right, good job. All right, let's go back to the questions here. What is the target A1C for most adults with diabetes? So this is the A1C. This is the 2 to 3 month average. It's a percent for most adults.
Below 7%.
Right, below 7 and below 8 for the elderly.
And then someone said above 6.5.
Above 6.5, yep. So actually endocrinologists, they're the diabetes doctors, if you want to call it, the specialists. They actually want people to be less than 6.5. So the lower that number, the better you're going to be in the long-term quality of life and less complications. So, and for kids, I didn't talk too much about kids, but pediatrics, about 7.5.
Okay.
For kids. All right. What blood sugar reflects hypoglycemia and what action needs to be taken? Hypo being little.
Low. Below 70.
Right.
Less than 70.
That's right. Below. And for some people, it's less than 80 because they've been high for a long time. You know, so maybe 80, they start feeling like, you know, all these symptoms that we talked about. And what should you do for that? Should you just
drink soda, eat carbs, orange juice, eat simple carb, glucose tabs.
Right. 4 glucose tabs, 4 ounces of juice, cranberry juice, apple juice, those little minute, you know, juice for the kids, those already have like 17 grams. You just suck that down if they're able to swallow. 6 to 7 lifesavers. Yeah, good job. And then what do you need to do? Just send them on their way?
Retest.
Retest. And what time frame? Five minutes, 10 minutes, 15 minutes.
15 minutes,
15
retest
minutes.
within 2 hours.
Right. So 15 minutes you retest. And if the numbers are going up, you have a snack or a meal with protein and carbohydrates. You probably just saved somebody's life right there. No kidding. The other thing is, if it's low, it's 60. What's Lily going to do? I'm going to do it again. So the rule on this, it's called the 15-15 rule, if that helps you to remember. 15 grams of carbohydrates, you check again in 15 minutes. Make sense? All right, number 4, what blood sugar reflects hyperglycemia and what actions need to be taken? So just give me some random numbers.
180.
180, yep. Anything above 180.
Greater than 180.
Yeah, 250, 300. And what should you do? I didn't really go into too much of what you should do, but you should drink non-caloric, something non-caloric drink, like something that doesn't have sugar in it, like water, non-caloric, because you're very dehydrated.
Someone said drink cinnamon tea.
Well, I'm not sure about the cinnamon tea, but the best thing to do is drink water because you're dehydrated. And the reason you're dehydrated is you're losing all your glucose and it's spilling out in the urine. So that's why people get thirsty, is because all the glucose, all the good nutrition is going out in their pee, and it should be going into the cells. So the other thing you can do if you feel okay, it's about 250. You don't feel, funny or symptomatic, go for a walk. Go for a walk, do something, clean your bathroom. And watch, the blood sugars will go down. Now, if it's a pattern, if it's been up there for like 250 every morning, and it's just like 3 days in a row, or you're just not feeling great, you got to call your provider, because you got to fix that. They got to help you fix that. Okay. All right. Name a microvascular complication. This one's a little bit harder, but that is one of the 7 self-care behaviors, reducing complications. What would be micro? Think about micro being small. So it's the small vessels, it's the small arteries, it's the small.
Blindness, kidney failure, vascular insufficiency.
Yeah, so it's the eyes and it's the kidneys. Absolutely. Yep. That's right. That's the screen right here. Go back here for a minute. That's a large, this one's a small. Yeah. So it's neuropathy. They call it retinopathy. And nephropathy is kidneys. Those are the small. And what about the large macrovascular complications? Macro being big.
Amputation.
Okay. Think big.
Stroke, heart.
Right. Stroke, heart. Here it is over here. Yeah, poor circulation. You guys got it. So I hope you learned something. I'm sure you did. And you're going to know how to save a life if you see somebody and they have a bracelet and it says diabetes and they're passed out. You call 911 to try to get them, if they're conscious, to get them, if they're able to drink, get them something. Save a life.
If anyone has questions, just type them in the chat. And then a last reminder, just making sure everyone typed in their name and email address. Sometimes your email address does not have your name in it, so we're not sure who it is. And we have to have a first and last name for the certificate plus the email address to send it to. So again, please just quickly type your name and email address here in the chat box if you have not done so.
And as we had mentioned, and just type the questions in there, we do a lot of CEUs. This is a whole laundry list. So we talk about the heart, we talk about diabetes, self-management, that's our signature program. So all of those 7 self-care behaviors, we could do a whole CEU on medication. We could do a whole CEU on monitoring, on nutrition. I can bring my dietitian. So we have a team of people that help us to do these things. So we could do it virtually, or we can possibly come to the care home, contingent on a couple things. We can do stuff for your staff and families. Sometimes residents are not really able to comprehend this stuff, but if they're able to. So this is a list, and I can also send that out to Audra to send it to you. Our phone number is on the top. And our email, you could always email me. I put it in the chat as well. And we'll get you what you need. some references. And I wanted to thank you for your time.
Yes. Thank you so much, everyone, for joining us. And if for some reason you did not get your name in the chat box or something happened, please send me an email to abarney@harmonyhospice.org. And thank you so much, Lily, for doing this for us today.
My pleasure.
And hopefully, we'll get some more scheduled in the future.
That sounds good. Any questions?
I don't see any questions. I see a lot of people saying thank you and very informative, and lots of smiley faces. So
awesome. And I just want to say knowledge is power, and I want to add to that if you use it.
True.
So I would say the most important thing is not just knowledge, but utilizing it for your residents, families, and in the community.
For sure.
All right.
Okay. Thank you, everyone. Thank you, Lily. Have a good day.
Bye now.
Bye-bye.